doctors registered, and it is grows with the time. And I'm happy that we have such opportunity to meet each other by using this possibility online, and to have possibility to share between each other our experience. But before we will start, I will start with my presentation. I would like to speak and to say a few words about situation all over the world with the pandemic. What happens with our company, and what happens in Georgia, in my country as well. Of course, from the beginning of March, we decreased our activity all over the world and practically canceled our activity because most of the biggest and small congresses postponed and canceled. For example, Dubai Derma, I plan to be there and to have presentation in middle of March, postponed for June of this year. Monaco conference, IMWC, also postponed for autumn of this year. For example, today I plan to fly to Monaco, and I had several presentations and live during Monaco conference, but unfortunately we are not able to be there, to meet there in April in few days. Same happens with the FACE conference. And it also postponed for the autumn for this year. And even, for example, ISAP's conference that was planned and scheduled for September of this year, it was postponed for the next year. That's why, of course, we decided to cancel our meeting in Georgia called HIDA 2020, and we will reschedule this conference, I don't know, maybe on autumn, depending of situation with the pandemic all over the world, or maybe we will change the date for the next year as well as, for example, ISAP's conference did. What happens in Georgia? For today, we have 97 confirmed cases with COVID-19 and 18 cases, recovered cases, which is, I think, good number. Of course, everything is closed. We are sitting at home. Borders are closed, no flights, and even my children's, they have online lessons sitting at home. Of course, we close our clinics in Tbilisi and Batumi almost more than 1 week. And as I know, we are closing our clinics in Moscow and St. Petersburg from today as well. Our offices, Aptos offices, closed all over the world more than 1 week. About 2 weeks ago, we closed our office in Czech Republic and in Berlin, and 1 week that we closed our office in Georgia. Several months our office in China is not working, but we are still online and we are working online, doing everything to help to our colleagues and to follow with our manufacturing process, and all needed process are still working with Aptos all over the world, of course. We are hardly working with our building of our manufacturer in Georgia. I will speak about it later a little bit, but quite difficult to work in such situation because most of the items are coming from all over the world for this building, and mostly they are from Europe, and it is not so easy in such situation. And of course, everything that we are receiving from all over the world are getting disinfection immediately on the place. Just a few days ago, we received trees we received from Italy. Hello, Italy. And we just started to plant them around our building, manufacturer building. So we are trying to work and to follow for this manufacture process as well. So situation is not very nice, but I'm sure that we will be strong, and we will fight in this war, and soon it will finish, and we will be able to follow our usual life. But for now, we should be closer to each other. That's why we decided to create a series of webinars, and this is the first webinar I would like to start with you today, with this presentation. After me, in the next days, this week and next week already, we are scheduling next webinars with Dr. Albina Kajaya, with my brother Konstantin Sulamanidze, with Dr. Murat Sinsadze, and all our other trainers as well. So I will start with my presentation now. I will speak general about Aptos, about our past, about history of threat lifting, about present situation in Aptos, and what we are thinking about future. It will take about half hour, 40 minutes for the presentation. Later, we can have some discussion. I see that there is a lot of doctors, more than 576 already registered. Italy, Israel, Qatar, Spain. I see hello from Turkey, hello from India, Jordan, Germany, Czech Republic. Hello, doctors. I'm happy. Russia with love. Hello, Russia. India, Libya, Prague, Greece, Indonesia, Dubai. I'm happy to see all of you here, colleagues. So later we will have possibility, Norway, Bulgaria, Iraq, great, to discuss on chat. So later write me your questions. So I will start with my presentation. First, I would like to say that our practice shows us that past years we are doing more and more less invasive procedures and less surgical. I mean the general surgical facelift with our patients. They are asking for less invasive procedures, and statistic from all over the world shows us the same. For example, surgical facelift in 2017. This is ISAPS statistic done by ISAPS. Members all over the world, almost 500,000 cases done in 2017. And look on the statistic of the same ISAPS colleagues, more than 5 million botulinum toxin injections, more than 3 million hyaluronic acid injections, and look, the same number, almost 500,000 non-surgical skin tightening, which is mostly thread lifting, done all over the world by my colleagues from ISAPS members. But if we will look the difference between surgical and non-surgical skin tightening, almost quite similar numbers in 2016, but look on the growth, only 4% growth in surgical facelift and more than 50% growth between 2015 and 2016 with the thread lifting, non-surgical skin tightening. I think this number will increase as soon as we will this situation with the pandemic finish all over the world, because I believe that our patients, they will not start immediately with the big surgery operations. They will begin with the small injectable procedures, and thread liftings also will be increased immediately, because patient will ask us more for less invasive procedure, as well it was before, and as well I'm sure it will happen after pandemic finish, and we will start our usual life, our usual practice. If we will look on the history of thread lifting, of course, thread lifting has a quite big, long history. Even in 1950s, we can find different kind of articles where doctors was trying to show and to use different kind of surgical suture, in that time non-absorbable surgical suture material for elevation of soft tissue on the face. They also invented different kind of needles or hooks to insert such suture in soft tissue. Even some needles was created in that time. For example, in 19th, golden threads was common in our practice, and these threads was used mostly for stimulation effect of skin and soft tissue. In that time was published such article in Yellow Journal. I found it, and it was shows that in Egypt was found a mummy with the golden thread on the face. I was trying to find some information about dear colleagues, sorry for this. There was some technical problems. I think while we are so many doctors are here, system goes wrong because we are almost 600 doctors here. So I will follow with my presentation. Again, I would like to say that this is the first webinar in that situation we have, so maybe something will go wrong. So sorry for that, but we will learn all these questions for now, and the next webinars will be without any problems, I'm sure. That will be with my colleagues. So I was speaking about golden threads that was in 19th. And they was using for stimulation of tissue for the facial stimulation, skin tissue stimulation, and it was written in one Yellow Journal that there was a found mummy in Egypt with a golden thread on the face. So I was looking on the Google, and I found such images from the Egyptian mummies and Egyptian life in that time. ancient Egypt. And look on these images. You can see that it looks like a doctor is preparing her patient for the thread lifting, and the nurse is holding threads in her hands for implantation. Or image lower, you can see that doctor with the real Caucasian nose, maybe Georgian, holding cannula. I think this is exactly visage cannula, and he's preparing to treat cheekbone for the face of his patient. Of course, this is joke, and even in that time, golden threads was quite common. My father, Marlen Sulamanidze, a plastic surgeon, started his research in 90s since 1987, and one of the first his idea in that time was so-called wire scalpel, which is wire for dissection of soft tissue. And first generation thread made from proline was patented in 1996. We started first on the world to manufacture our threads in 1998. This is our old first generation thread packages manufactured in Russia. In that time, we had two different products. It was thread with the 6 and pack with the 6 thread and pack with the 4 thread for the different areas. Of course, made from non-absorbable proline bidirectional first generation thread in that time. We started first manufacture also in USA in 2001, and we get FDA approval in 2003 in that time. And the name of the product there was Aptos Feather Lift, feather like a bird feather. And our first manufacture process we also started in 2001 in Europe with the company Asut Europe and the company Promo Italia. The name of the product we created there, we started to manufacture, was Aptos Soft Lifting, and this is old package from there. Most important is that the thread lifting was created by doctors for doctors using their practice. And my father is the first who, let's say, introduced thread lifting for aesthetic world for all over the world. And as I told you, Aptos Wire, his first idea since 1987, and first generation thread was patented in 1996. Since that, we created second generation thread with the double-edged needles. We started with absorbable material thread PLACL since 2006, and one of our best product in 2012, Excellence Visage, which is still alone in the market. This is the best product, excellent product for the face contouring and face soft tissue reposition. We also have threads for stimulation effect, and since that we created a lot of different kind of methods and products as well. So what is Aptos today? We have 13 offices all over the world with more than 200 employees. Our main office present here in Georgia, in Tbilisi. I'm here. And we have 3 offices in Europe, which is in Czech Republic, in Germany and Latvia. And we have 3 offices in Asia, which is China, Korea, and Japan. And we have 5 offices in Russia for CIS countries, and main office for CIS countries present in Moscow, in Russia. Today we have 2 places for manufacture of our product, and one of is in Germany, in Berlin, and second is in Moscow. Moscow manufacturer is made manufacturing product for CIS countries, and German one in Berlin made and manufacturing product for all over the world for other countries as well. And as I already told you, we already started to build a new manufacturer here in Tbilisi, and this is the slides and photos from we started to build this building 1 year ago, and now we already have this building, and we are making all process inside. Not easy, but anyway, we are working hard, and hopefully this year we will open our manufacture, where we will not only manufacture our threads, but we will also have quite nice garden with the Italian trees. Again, I would like to repeat, and hello Italy again. I see you are here, and my colleagues from Italy as well, and we will have time to have a sport, and also for relax as well, because we will have this nice place where we will create a nice Georgian wine, and we will be able to invite you all there as well, not to see our manufacturing process, but also to taste a nice Georgian wine as well, which we will do by ourselves. Just to imagine the quantity of the threads we are manufacturing every year, this is the number of the product that was sold only by Russian office in 2017. This is 372 kilometers of the threads sold by Russian office for CIS countries in 2017, and this is the road from Tbilisi to Batumi city in Georgia, which is seaside city, very nice place. We have a clinic there as well, and hopefully soon we will this situation with pandemic will finish, and we will be able to meet all of you in Georgia, and I will be happy to invite you to Batumi as well, because it is very nice city as well. So Aptos, anti-ptosis, this is the main idea of Aptos, to fight against ptosis on the face of our patients. And today we have 30 different kind of products. As I told you, we have non-absorbable and absorbable material, which is PLACL threads, which is the best composition by our opinion for the threads. And you know that we have a lot of different kind products, different kind methods. But the most important question is that we believe that we are not just manufacturer of the threads. We are, let's say, we are creation solution for the doctors. We are creation solution for our patients, for rejuvenation, for their face and body. And this solution cannot be one solution for everybody. We cannot have one product or one method for all different kind areas on the face or even on the body. That's why we have different products for them and methods for the face, for the body, even for armoring and stimulation effect. And also we have a special methods for the different areas, like method and thread for eyebrow, method and thread for cheeks, for mental, submental, rhinoplasty, nose correction, otoplasty, or even intimate correction as well. On my presentation, I will briefly speak about different areas on the face and which product and which methods mostly I'm using in my practice in the nearest days, this week and next week. We will speak about all these methods, all these areas separately, with a good discussion between our trainers from all over the world. And I hope we will have a nice webinars soon as well about all these products and methods. But let's start with the eyebrows. And one of the best solution for the eyebrow is, in my opinion, is the needle method, because we can fix our threads in tissues quite strong on the eyebrow area and elevate quite easy these mobile tissues on the end of the eyebrow. Small video that I would like to show you right now will show you how we can use this method for the eyebrow. 2 double needles. This is a blunt tip cannula, what is very important, you can see. And blunt tips are designed so that we are able to pass skin and exit with a blunt tip cannula from the skin, but from other side, we are not damaging tissue so much. We are avoiding to damage vessels, and even here you can see that I'm doing several movements inside to create a triangle to catch tissues on the end of the eyebrow and elevate it practically no damage of soft tissue, no even drop of the blood here, and immediately quite nice effect of elevation of the eyebrow with the strong fixation immediately. And this elevation will remain for almost two years, and the recovery period just few days, because you can see that there was even no swelling. In that case, I'm trying to elevate upper periorbital and upper medial compartment here, which is shown on this slide. So next method which we can use for the eyebrows is nano excellence. Dr. Albina Kajaya will have a nice webinar this Thursday, 2nd of April, speaking about nano excellence method, and this is exactly her hands. You can see how she is using nano excellence for elevation of the eyebrow. And this is also very nice method because it is quite easy for the beginners mostly, and for such patients who doesn't need to elevate end of the eyebrow too much. Just a little bit change to reshape the end of the eyebrow, and mostly in combination with the toxicity, it will be very nice. So Dr. Albina Kajaya will speak about it this week later more, and will explain how to use nano excellence methods and how she is using in her practice these methods. Eyebrows is very good in combination, as I told you, with toxin, and usually we combine it few days before the thread lifting. We do injection of toxin for the forehead, for the eyebrow. We stop mimic activity, which is most important for us because mimic activity is the main enemy for the thread fixation. And we need to stop this mimic activity, and just then after, few days later, we can use thread for elevation of the end of the eyebrow. And depending which direction we need to elevate, more laterally or more higher, we can choose a different direction of insertion of our threads. Next method and next area is cheekbone area, middle part of the face. And of course, in my practice, the best product for the cheekbone area, of course, is Excellence Visage. This method is really excellent for the middle part of the face, because here we have 10 threads. We can separate these 10 threads for full face. And what is most important is that we can not only elevate tissues, we can not only lift tissues like usually patient asking us, but inserting tissues threads a little bit deeper near to the SMAS, above SMAS, just sliding on the SMAS, we can create such nice volume immediately. You can see that how nice volume I created on the cheekbone area on the right side of my patient, using just few threads for her cheeks. And this is the way how I insert, usually quite deep, to elevate, to harvest tissue from the deep, sliding right above muscle of the SMAS, and reposit tissues on the middle of the cheekbone area. Here we are trying to reposit nasolabial and central buccal compartment. These two compartments are quite mobile here, and all the tissues are laterally, has possibility to fix our threads here and to elevate them more on the lateral position. Immediately after, we are getting quite nice results, as you can see on this patient. We can see a nice elevation of the cheekbone area, nice elevation of or even jaws, because we can separate these 10 threads even for the 2 entry points for the cheekbone area and from the tragus for the jaw area, and we can get immediately nice effect, nice result, without practically too much swelling on the face. And recovery period while we are using threads with the cannulas is quite fast. This is only third day 3 days after, look on the face of my patient. She looks very nice. 3 days later, no swelling and immediately nice shape of the cheekbone area as well as jaws. This is again patient after a few days later. No, sorry, this is patient after about 1 year, sorry, later of using that threads. Mental area. Thread method, thread second generation method is the best solution for the jaws. I think this is the best to elevate jaw compartment, which is usually dropped down and patient exactly asking to create a nice sharp shape for the jawline. And I will show you this video for the jaws. Entry point from the tragus and two cannulas that are following the jaw here with the exit at the end of the after the jaw compartment. So we need to catch jaw compartment with the threads. We are right under the skin because we need to elevate skin exactly, not to create volume with the soft tissue like we did, for example, for the cheekbone area. Immediately, we can see a nice effect here. Look on the left side of my patient, and we have a nice elevation of the jaw compartment as well. So thread method is the best solution for the jaw, and usually when I need to have a nice effect, mostly for the patient after 50, 55 years old, I usually combine Excellence Visage Soft with the thread method for the jaw compartment. And Excellence Visage Soft I'm using for the cheekbone area to create volume, and jaw I'm doing with the thread methods as you have seen right now. Again, I like to use needles with a blunt tip cannulas. That means I'm avoiding to damage vessels, so I don't have any hematomas, and I have quite fast rehabilitation period for my patients, and even for the heavy tissues it works very nice. Of course, if we will speak for the neck correction, the best solution for the neck is needle method. Here we need to fix our threads behind the earlobe on the platysma auricular ligaments. And next week, I think we will have a nice webinar with Dr. Konstantin, my brother, and maybe we will also invite some of our colleagues, our trainers, to discuss about neck. And I think we were thinking about to do webinar about combination of using thread and liposuction or lipolysis as well. So we will speak about more about this method for the neck, how we can use threads for lower part of the face. But before that, briefly, I will show you a video how I'm doing neck with the needle method, with the needle blunt. Of course, I like blunt cannulas because again I'm not damaging tissues so much. I'm starting with my cannulas behind, right after the earlobe, catching platysma auricular ligament, which is very important to catch it because otherwise we will not have a good fixation there, and later we can lose results. So we have to start behind the platysma auricular ligament and move all the thread from one side to another side. These movements are very important when you are turning needle inside and you are not exit with the tip of the cannula totally. You can see that blunt tip cannula sliding inside of tissues quite nice. Of course, we have to choose our patient, especially for the blunt tip cannulas, because blunt tip will be difficult to use for the patients after facelifting, for example, or it will be quite difficult to use after any face surgery like liposuction. Or even lipolysis sometimes, when patient did it several times, create some fibrotic tissues, and blunt tip cannulas are not sliding so easy there. In that case, we can use cannulas with sharp ends, but we can get the same result as well. So immediately we are getting quite nice fixation of the lower part of the face on the submental area. And even for the heavy tissues, when we have possibility to combine our thread with liposuction or lipolysis, we are getting nice effect for our patient, and needle method is the best solution for the neck as well. So what is expectation from the thread lifting method? What we are expecting when we are using threads in our practice? Of course, we are expecting that thread should be easy in use, because it is really easy method. It should be non-traumatic, because this is not a surgery, and patients are coming to us and asking for non-surgical approach, for face rejuvenation, for reposition of soft tissue. So it should be not traumatic, of course. Thread should have enough possibility for soft tissue reposition, and the result from thread lifting should be as minimum for 1 year, because we are still doing not so easy procedure that sometimes takes for rehabilitation. If we will do full face, eyebrows, neck, face as well, it takes sometimes 1 week or 2 weeks, depending of the age of the patient, depending of the method what we are using. That's why result we should expect for minimum 1 year. Of course, we should not create scars, because patients are doing our thread lifting not once in a life. They are doing it periodically. And also, we should expect some stimulation effect as well. But what we have right now on the market, today we have a lot of different kind products, different kind composition of the thread present on the market. In our practice, as I told you, we use composition of the thread made from PLACL, polylactic and polycaprolactone threads. But we can find on the market different thread made from PDO, PLA, for example, polylactic, or separately from polyglycolic acid, or combination of polylactic and polyglycolic, or even polycaprolactone thread as well. But looking on this market, we see that all of these threads are made and created for wound closure, like a usual surgical suture material. But for the wound closure, for the surgical material, as a surgeon, I understand and we know that we don't need a long-lasting absorbable period for the thread. When we close the wound, we need to have our thread to disappear in maximum in 1 or 2 months, because I don't need long-lasting thread inside of the wound, which I close with a suture. Otherwise, I will use non-absorbable thread. And looking on all manufacturers and their research, we see that all these threads, PDO, polyglycolic, polycaprolactone or PLA thread, they absorb quite fast, less than 1 year, sometimes in 4 or 6 months absorption period. For example, PDO threads absorbs between 4 or 6 months, depending of diameter of the thread, and it is shown by the different kinds of research. Or, for example, polyglycolic acid, like coins, the article from 2016 by Roberto Pizzamiglio, you can see that coins absorbs in 6 months after implantation. That means that we are losing fixation of the thread inside of tissue. So in my opinion, and in our opinion of Aptos, the best composition of the thread on the market now we have is PLACL, polylactic and caprolactone threads, because absorption period, and it shown on our research we did few years ago, and it was published about 2 years ago in scientific publication. You can see that after implantation of PLACL, after 72 weeks, which is 1.5 years later, only 41% of the diameter of the thread was absorbed. It means that more than half of the thread diameter is still present inside of soft tissue. And if I will look the same on my practice, I see that after implantation of the thread, elevation of tissue, I'm getting immediate result. Usually patient doesn't like this result immediately because they have some swelling, some asymmetries and irregularities on the face. But later, after 1 week, after 10 days, they already satisfied with the result because everything disappear, all the swelling disappear, and recovery period finished mostly the later, maybe after 2 weeks in the aging cases, for example, and patients are happy and satisfied with the result. Then result become better and better with a few months. After 1 or 2 months it is better, and there we have like a stabilization after till 1.5 year. After 1.5 year, patients see that they are starting to lose result with the time, and exactly the same happens with the histology. 1.5 year we have more than 50% of diameter of the thread inside. So it means that threads are still holding tissues inside, still fixing tissues inside where we elevating them. And later, between this 1.5 and 2 years, last 6 months, all the thread disappear. At the end of 2 years, we don't have PLACL thread inside of tissue. That means that we can expect our result for our patients with that composition of the thread for almost 1.5, between 1.5, 2 years, and usually patients come to me again to repeat the procedure after 1.5 years. They don't want to wait when they will lose results totally. On the market today, we also see another question that threads are stimulating something when we implant them, and is it right? Do we have a real stimulation from the thread lifting? If we will look on different kind of research that are present now on the market from the different companies and different doctors as well, yes, threads are stimulating tissues. And looking on the articles that are published with histology of PDO, for example, threads or PGL threads, they show that they really stimulating something on the tissues. But what is most important that in all these articles shows that only second type of collagen is stimulating. No type first appearance of collagen we have after PDO implantation or after any other threads implantation in soft tissue. It was one of quite interesting histology done in 2001, published in 2001 in Russia. I have a reference of all these articles lower on my last slide, and this histology shows that doctors was using Prolene threads implanting in soft tissue, and they have seen that Prolene thread did some stimulation of tissues, and they found that it increased collagen second type stimulation and also increase number of vessels around the threads. But when we implanting Prolene thread, do we expect any stimulation from the composition? Of course not, because it is non-absorbable suture. So what happens? What we have seen from this article is that just usual any foreign body which we implant inside of tissue, we are getting some stimulation of collagen second type. But collagen second type is just fibrotic tissue. This is just a scars. From one side, it is good for our patient because we increasing some armoring tissue inside of soft tissue of our patient on the face, for example, or on the body. But from other side, is it real stimulation? Of course not. We need another stimulation. So when we were thinking about this question in our company, we understood the best stimulation effect, what we can get is not a foreign body. We should find stimulation from something which is composition exactly, and the best stimulation on the market right now is hyaluronic acid. That's why we decided to combine our threads, PLACL thread, with hyaluronic acid, and this is the first product on the market which gives a real stimulation effect. Yes, doctor, I agree with you that trauma from the needle even can stimulate tissue when we are implanting threads. So what we are expecting from the threads with combination with hyaluronic acid and PLACL, we are expecting more biocompatibility, less inflammatory reaction around such thread, and of course a real stimulation effect, stimulation of collagen and elastin itself. We did histology research that was published about more than a year ago. So we compared PLACL, usual Visage, Excellence Visage thread, and the PLACL with hyaluronic acid. And this is some slides from this research, from this publication. Look on inflammatory reaction. Look on the orange line, which is quite stable inflammatory reaction, straight line. That means that in comparing with the blue line, which is just PLACL thread without hyaluronic acid, it means that inflammatory reaction with the thread with hyaluronic acid is quite stable, and we are reducing time for rehabilitation of our patient, and also we are reducing creation of capsule formation around such thread. And look on the right slide that shows that capsule around threads with hyaluronic acid is quite thin, and it is less because we are not increasing stimulation of fibrotic tissue around the thread. We are not increasing scars around that threads. This is very important because our patients are doing this procedure not once in their life. They are repeating this procedure several times in their life, periodically after 1 or after 2 years. That means that if we will increase quantity of scar formation inside of tissue, it will be not very nice for their tissues. That's why we have to try to reduce scarring around the threads. Another question is stimulation effect itself, and we know that hyaluronic acid is the best stimulation of elastin. And look on the slide that shows that even after 2 weeks, we are increasing stimulation of elastin around the threads, and it increased with the time after 1 or 2 months later after implantation of the thread with hyaluronic acid. And the same happens with the collagen. And what is most important, collagen first and collagen third type, which is also increased for almost 30% after implantation of that thread. That means that we are getting stimulation effect not only from damaging of tissue by the needles. We are getting stimulation effect not only by inserting of just foreign body inside of tissue. No, we are getting a real stimulation effect from hyaluronic acid, from composition of the thread, which we are expecting with our product, with the new third generation product in our case. This is the article, and I will have a reference on the last slide. We published it about this histology and some cases of my patient. For example, 1 pack of Excellence Visage with hyaluronic acid. 2nd day only. Look on the patient. Practically no swelling, no edema. Quite nice effect. Only 2nd day after. Looks very nice, and immediately nice result. Just 2 days later, here, I used Excellence Visage for the lower part of her face, for the jaw and submental area. And on the neck, you can see some bursing, some hematomas here. And this is not my work. This is this is toxin injection she did just few days before me for stopping mimic activity on her platysma bands. So I combined toxin with the Excellence Visage. So my wife, Dr. Albina Kajah, she's a dermatologist. We are working together usually. So this is her work. This is her hematoma, not from the hyaluronic acid threads. And this is just 2 days later after thread lifting. Sorry, Albina. Another case, young patient, 1 pack of Excellence Visage for full face, again with hyaluronic acid. This is how usually Visage is working for such patient. This is about 8 months later. Nice elevation of cheekbone area, nice reducing of marionette line, and quite nice shape of the jawline as well. But this is not so important. We are looking for some stimulation effect and look on the different quality on the skin before and 8 months later. It is really a big difference on the face. Even for the aging patient, for example, this patient, she never did any injections on her face. It was the first time she came to plastic surgeon, and she was afraid to do any surgery. So what I can do as a surgeon, as a plastic surgeon, of course, I can offer her facelift and she will have a great result for the facelifting, but she afraid to do it because she is a first time in such clinic. So what I can suggest her is thread lifting, and I use it 1 pack Excellence Visage with hyaluronic acid. This is almost 1 year later result. Look on her face, nice elevation of tissue, reposition of tissue, and look on the quality, how changed quality of her skin without any injections. We did not did anything for her face at all, just only threads, so with hyaluronic acid. This patient did facelift before me, and I also did different combinations, like we did some lipolysis for the lower part of the face and some threads for the needle method for the jaw, for the submental area, and Visage for her cheekbone area. Look for this result and look for the difference, how it looks like on the skin after almost 1 year later. One more case, again about 9 months later with the Visage, and again good quality, different quality of the skin after Excellence Visage with hyaluronic acid. And one more case, again aging patient. Nice results and nice skin quality. So this is my reference. You can save this slide if you like. And this is the articles I use it to prepare my presentation. At the end of my presentation, I would like to invite all of you on Facebook group. This is closed Facebook group, Aptos Expert, where we are publishing different information about Aptos and about thread lifting, and we will also have live webinars there as well as direct link, which we will publish later. So I invite you there, and also I invite you on Dr. Albina's webinar that will be on this Thursday, April 2nd of April. She will speak about nano, quite interesting talk, I think, and interesting for the doctors, because we can use nano threads for different cases, for different application on the face, and even for the body, for armoring, for stimulation, and sometimes also for reposition of tissue, what is very important as well. So I invite you to join this webinar as well, just in few days on this week. So now we are ready to follow with questions and discussions. I'm happy to say that right now we have more than 800 doctors looking on our webinar. I will move on the video. So we have several questions here. So let's start. Collagen, I spoke about the collagen as well. So do you combine brow lifting with the with the botulotoxin injection? Yes. We are trying to combine these two methods together because this is, first of all, it is very important. Mimic activity is main enemy of the thread fixation, and we have to stop mimic activity first and later to use thread. And also, second is that before thread lifting, I think that we can ask patient to try toxin, because sometimes they are getting quite nice effect even from toxin injection, and later we will combine it with the threads. What about injury for the temporal branch or facial nerve? First of all, I would like to say that next week I think I will do a webinar about complications, and I will speak generally about complication with the threads, what can happen with the thread lifting and how to prevent this complication. First of all, I would like to say that yes, during all our practice we have seen some injuries of the facial nerves, but it was not damaging facial nerve by the thread itself. In most cases, it was just blocking of the threads of the nerves function because of the swelling. And there is some cases we have seen from the different colleagues as well. In our practice, we have seen one case for the eyebrow, but all these cases disappear, all this problem disappear in a few days, depending of the rehabilitation period. I will speak about it later. Could you tell us a new date of Colhida? Not yet, unfortunately. We will look on the situation all over the world. How effective is the visage for the neck area? Let's say the best solution for the neck is needle method. Second after it is a combination for the beginners, for example, is a combination of thread method from one side and another side, and nano-excellence method for submental area under the chin here. So this combination will give you a very nice result. And using visage for the neck, let's say this is mostly for armoring of this area, and a little bit correction, but not the best. Not the best for the jaws. I mean for the neck. How can we decide the right point of entry for each area? What is our landmarks? Again, I would like to invite you for our next webinars, and we will speak more details about exactly our different areas and how to choose these points. In general, I would like to tell you that usually we are choosing all these entry points on the lateral part of the face, because lateral part near on the border of the hairline, we have so-called repair points. Here, the tissues are not so moving, and we can fix our threads quite hard. All the tissues are near to the medial part of the medial line of the face are quite movable here, and we can elevate them on the lateral position. So choosing lateral points is the best possibility to fix our threads, and we will speak about it later, more about exactly different kinds of webinars, because we are going to separate areas and separate methods on the face. How can I share my patient photo with you? I am so happy with Aptos. You can share. You can share these photos on the Aptos expert group. Why not? And everybody will see your great result, dear colleague. When it will be possible to buy these HR threads, it is already possible. We are managing with the registration process in some countries, but in most, for example, in Europe and most of Asian countries, you already are able to buy this thread because we already have registration. Some countries we have still pending for registration, but soon we will finish. And I just would like to, let's say, pre-announce that we plan to have to start with a new product, with hyaluronic acid product, our products on Monaco conference, IMWC, but unfortunately it was postponed. So I think soon we will start with the new products as well. Post-thread recommendation for the neck area. We will speak about this, and I already spoke about neck, and we will have a great, nice webinar next week. Thank you, George. I want to ask you about experience with the effect longevity of the neck lift. Thank you. You know, again, depending on the methods. If we speak about needle methods, which is again, I would like to repeat, the best product for the neck. What is most important is to follow all the rules of using needle method for the neck. I think we will speak later with a different webinars about neck and needle method, because it is very important, because needle method is one of the most difficult methods we can use in our practice with the Aptos. And if we will not follow small tips that are very important in using needle for the neck, we will lose result quite fast. And sometimes I have seen that my colleagues, they showed me cases after 3, 4, or 6 months losing result after needle method. So I think we will do a good webinar for the neck as well. Can after thread implantation give PRP and hyaluronic acid injection? Very good combination. Of course, PRP we combine 1 week before, same day, and 1 week after, and we reduce time of rehabilitation of our patient. And if we do about hyaluronic acid injection, usually we like to do it 1 week before the thread lifting. I spoke with Dr. Albina, and we are preparing now also another webinar about combination of using threads and different injectable procedures, speaking about protocols of combination of different injection. When using Aptos thread in combination with radiofrequency tightening thread, how long do you wait? RF treatment. First of all, I would like to tell you that using any machines is better to do it before threads, because we are preparing tissues, we are preparing skin for the thread lifting with the machines, and later, after 3 weeks, 4 weeks later, we can do threads. If we will do machines after threads, we have to do it not earlier than after 1 month after thread lifting, when all the rehabilitation period will finish. Most important, we have to understand that we are not heating thread itself. I mean that we cannot damage threads or burn threads itself with the machines, because I'm sure that tissues of the patient will burn first than any threads inside. So we are not worrying about it. Absorbable threads will not accumulate heat. Maybe it can happen, for example, with the golden thread. I don't know, because it is metallic, and we have to be afraid of using such machines with the heat for the golden threads or metallic threads. I don't know. This is just my opinion. But after 1 month of the thread lifting, we can do any machines. Thank you for the presentation. Thank you, dear colleagues. Can you explain about anesthesia injection before thread lifting procedures? Anesthesia is also a very important point, and I will have a webinar about tips and tricks for the good training, for the good results with the threads. But generally speaking, of course, we should not let's say, increase tissues with the local anesthesia. We just should insert local anesthesia along each threads separately, just a little bit, because not only the pain is very important for our case, but also the second, which is also important, is stretching of the vessels. That's why we are using anesthesia with adrenaline, with epinephrine, and inserting local anesthesia along the thread is very important. And how we do it, and we do it with a cannula, of course. I will speak about next webinars we are planning and speak about it later. Thanks, doctor from Iraq. What happens with the patient has multiple thread lifting and then facelift if there's fibrosis increased? Of course, there is a lot of opinions of different kinds, doctors all over the world, that, for example, after several thread lifting, it will be difficult to do facelifting later by the surgeon. First of all, I would like to tell you about our experience. We are using threads since 1994 or 95. My father started with the first generation thread with Prolene, and in that time we was using a lot of non-absorbable Prolene threads. Later we started with absorbable material, and of course since that time we have a lot of patients we did face after thread lift. When we found when we did patient with non-absorbable Prolene thread, we found that thread on the way of our dissection, and believe me, it was not a big problem to remove such thread. Just, of course, it is not so easy because they are hardly fixed inside, and in most cases we do not remove totally this thread. We just reposit and fix them in new position, and it also helpful for your facelifting because you have extra fixation of your soft tissue inside during your facelifting as well with the threads. If we will speak about absorbable material, usually if patient did thread lifting more than 2 years ago, maybe you will not even understand that there was threads before you, because threads are not formatting so many fibrotic tissues inside, so many scars, that it will make you some problems with the facelift. But from other side, we have to understand that most of our patients that are coming for facelifting, they already did a lot of other injections, a lot of other procedures before us. So we should be ready that our facelift will be maybe not so easy for such patients. Post-thread recommendations. Post-thread recommendation, we have such paper for the patient. You can download this brochure on our website, aptos.global, and it is written everything there about post-recommendation, post-care for the patient as well. But in general, let's say, as soon as I finish my procedure, we use ice pack on the face of our patient. It is very important that you clean, on your nurse clean face of your patient by yourself, because patients still have anesthesia on their face and they will see lines of the marker, or they will see some betadine on their face, and coming back to home, they will try to hardly remove this marker on her face, and they will destroy your fixation of your thread. Also, patients should use ice pack during first 2 days. 24 hours, mostly important for this day only till the end of the day. During first 2 days, no washing her face. Of course, no makeup on the face. After 2 days, she can allowed to do even makeup on her face. Of course, first 2-3 days, no hot food, no hot drink, because it will increase swelling. For 2 weeks, no hot procedures like bath or sauna, and no massage, no massage on the face for one month. How to avoid dimplings? We will many times in my we will speak about it with my presentation next week. I think we will do a webinar about complication. Just we have to insert in right direction our thread in the right plane, and I will speak about it later. I heard that it is better to have non-hyaluronic filler before thread. Is that true? It is better to have non-hyaluronic filler. Dr. Vladislava, what you mean about non-hyaluronic filler? If you mean non-absorbable permanent, of course, we're not doing threads with the non-permanent fillers with the threads, but I don't understand. Could you repeat eyebrow video, please? Okay, before I am speaking with you, I will repeat eyebrow with a needle. So let's see all other questions. Dear doctors, also you can rate this webinar. You can see there the link. It will be interesting for us to make better next webinars as well. This is another video for the eyebrow. Thank you, colleagues, for your words. Should we use bandage? Yes, we can use bandage for our patients if we do neck. Mostly if we do combination with the hyaluronic acid. Oh, sorry, in combination with liposuction, but not for the face. Yes, we will record this webinar and we will publish it on the Aptos Expert. Can we combine with hyaluronic acid? What we do first? Yes, we combine with hyaluronic acid fillers, of course, and the best if we are increasing volume on the, for example, on the cheekbone area, and we need to increase volume on the cheeks to insert deep hyaluronic or other fillers. In that case, we do this filler first and then we do threads. But in case we need to correct small areas like nasolabial fold, like marionette lines, for example, or tear trough, in that case, we do thread first and later we do, after 2 or 3 weeks, we do hyaluronic acid fillers just to correct small areas. So what is about radius combination? Yes, about calcium hydroxyapatite combination, exactly what I spoke about cheekbone area. When we need to increase volume and we do deep insertion we do it before. But in case if we use like mesoradius combination, in that case we have to do it about 3 weeks, 1 month before the thread lifting with the Aptos. 1 year or 1 year and a half ago in Russia, there was our company Aptos and also Mer's company from Russia collected their and our trainers together, and we wrote a consensus together how we combine radius and threads. So this consensus was published last year, as I remember, and it shows exactly that first we do radius and later we do thread lifting. Dear colleagues, maybe I will not be able to answer you all your questions because there is a lot of questions here. So we will try to answer some of the questions later on the Aptos Expert. And with the next webinars, we will speak more. Did you advise to put garments after using? Yes, after using threads. Yes, we are advised to use steady strip on entry points. This is after thread lifting. This is like more helping patient to care themselves after the procedure for a few days, because even we tell them that do not wash your face, even we tell them do not do makeup on the face after thread lifting for 2-3 days, they can do. And when they see steady strips on entry points on their face, they will avoid to touch this steady strip. So it's better to close these points with steady strip, and you tell your patient remove them after a few days later. What was the brow lift with the needle or cannula? Cannulas, only cannulas we use for the eyebrow. It's better to have thread first than filler. Yes, if we are correcting small areas like nasolabial fold, tear trough, marionette line with the filler, threads are first, and after 2-3 weeks, when rehabilitation period will finish with the threads, later you just correct the small areas with the hyaluronic acid filler. Can you please explain the use of Nano Excellence for the neck? As I told you, Dr. Albina Kajaya will have a webinar on 2nd of April about nano threads. Just follow us on our Facebook, and you can have all these questions answered by Dr. Albina. Perfect, thank you. So thank you, colleagues. We practically today reached 1,000 doctors. It was more than around 900 doctors. I'm happy to be with you today online. And again, I would like to say that even we are not able to meet each other, even on Monaco conference, which was postponed, and we plan to meet each other next few days. But we have such possibility to share with you our experience. So starting from today and next with Dr. Albina on Thursday, on 2nd of April, we will start a series of our webinars. Please join us. Please collect all your questions. We will try to answer you all questions. We will separate different methods, separating by areas, by methods that we are using, and also with Aptos, and also combination. We will speak about complication. We will ask our trainers to join us on our webinars and to create some discussions as well. So hopefully we will have a nice, interesting webinars nearest time, and you will join us. I'm happy that we have such an opportunity. So thank you to be with me today. and see you soon on the next webinars. And hopefully this situation all globally that happens with pandemic will finish soon, and we will be able to meet each other somewhere in the world. Thank you again, and see you soon. Thank you. Bye.